Okay, so I just started recording, so we'll still have a few more minutes before we start each of the speakers to present their own connected networks or their own projects in this regard. So there'll still be some time for people to come in and join us. But first of all, good afternoon for everyone. I know this is, at least I know that in Eastern Europe, I think it's in Sweden or so, there's like a holiday period coming up. So there are a few different holiday periods and national holidays here and there. So thanks a lot for being here. The point of this webinar today is for us to discuss which projects, which networks, which initiatives have been connecting stakeholders throughout the European space for health and care innovation, and particularly for active and healthy aging. The point is, of course, to discuss what are these ongoing and current efforts, and then, of course, also what could be the future for this area regarding connecting stakeholders and engaging them for higher collaboration, for joint policy, for joint research, and so on. For us and from my end, my name is Claudio Santos. As some of you who have accompanied the IN-4-AHA webinars should have known by now, I'm from the University of Porto, which is a partner of the IN-4-AHA project, which aims to increase the uptake of innovation for active and healthy aging solutions. And one of our activities, of course, is stakeholder outreach. Today with me, we will have three speakers to present their own projects and initiatives. Martin Licht, Policy Officer at European Social Network, Nicola Filizola, Communication and Public Affairs Manager at AAL Association, Bettina Glaser, Steering Committee Member for the Joint Program Initiative More Years, Better Lives, and also Birgit Morlion, which is a Program and Policy Officer at the European Commission. First wish is that I haven't botched any of these names, so if I did, please be sorry. I'm very sorry about that. And now that we can start presentations, because we already have some time here for everyone to join us, there will still be people coming in, of course, but we can already start the presentations with Martin Licht. So Martin, if you want to start the presentation about the European Social Network, please feel free to do so.
Thank you, Claudio. I'm just sharing my screen, so a few seconds, please.
We always have like the Zoom waiting period in these moments, right?
Yeah. It gives you the time to take a sip of coffee or tea or whatever you're having at your desk.
Yeah.
And I can tell you that my neighbors are drilling their walls. So should you hear some noise in the background, it's my neighbors drilling. Okay. Do you see my full screen? Do you see my full screen or the presentation?
Yeah, we see the presentation.
Okay. So I present myself. I'm Martin Lichte, and I hear some noise in the background. So maybe someone has the microphone open. I'm Martin Lichte from the European Social Network, and I was asked by Claudio to present our network with regards to active aging and health policies that you are promoting. And the topic of the session is connected networks for active aging and health, a better way to cooperate and innovate. And so I named my presentation the European Social Network, a network steering cooperation and innovation in active and healthy aging. And so I will present you how we steer innovation and cooperation in active and healthy aging. And I'm looking forward to the discussion afterwards with you on the role of networks in this regard. So the European Social Network is a network of public social authorities mainly. So we have members from the national, the regional and the local level, mostly local and regional levels, so also municipalities, bigger cities, social services departments of cities, so health ministries, social ministries, and we have about 150 members in 37 countries, which means it's not only in the EU, but also beyond EU borders. But the main constituency of our membership is in the European Union. And our members are also associations of directors of social services, so at national level, and providers of social services, public providers of social services, think tanks and universities doing research in social policies. And yeah, to our activities, we often invite the directors of social services, decision makers, and researchers. And our members work on all user groups, so not only, but including with older people. And so I will present some activities in that regard. So how do we help to our members to connect and innovate in the area of active and healthy aging? We have a lot of networking and knowledge exchange activities. We have, for example, working groups, and in the time from 2018 to 2021, we have 3 working groups that touch upon this issue. So there is the Integrated Care and Support Working Group, which this year discussed integrated care and support for older people with complex needs. I will explain a little bit more about this in the next slide. We also have a working group on the EU semester, and we are comparing the progress of member states from the point of view of local authorities, and we have a special look at the principle 18 of the European Pillar of Social Rights, which is about access to quality long-term care. And we also have a working group on digitalization in social services, so which also touches upon aging policies, preventative policies through digital means. We also have seminars. So once a year we have a seminar on a special topic, and regarding healthy aging and long-term care, we had different seminars that are fitting into the topic. So we had a seminar on retaining and regaining independence, so really in the heart of active aging policies. We had a seminar on co-production, so on the involvement of users in the provision, in the planning, in the commissioning of services for all the people, like long-term care services, active aging services. And last year we had a seminar on quality in long-term care, meaning looking at how procurement of long-term care services and the contracting in this can contribute to a better quality of long-term care. And we also make peer learning visits possible for our members. So when a member identifies a good practice from another member, they can apply to have an exchange visit. So then they visit each other and learn more about that service. And of course, in the moment, this is not possible because of the COVID rules, but in general, this is a very demanded service that we offer to our members. And on the working group of integrated care and support, I talk about this because it happened this week. So on Tuesday and Wednesday, we met with our members, of course, digitally, to discuss how integrated care and support can be organized for people with older people with complex needs. We had 3 sessions discussing with WHO, the Eurocenter in Vienna, with the OECD, which benefits integrated care and support has for older people, and also how this can be evaluated. So how can the progress in integrated care and support be evaluated by national or regional authorities? And our members got some tools from those organizations how to do that. And we also discussed an internal ESN survey, because we asked our members how they progress on integrated care and support for older people. And we had small group discussions, meaning that we tried to replicate a little bit the effect of coming together in working groups with personal exchange in a congress center, but digitally, where people really have the personal exchange in these small group discussions. And then we also heard different best practices on integrated care and support from 4 countries, and also how the Commission supports the reform of the care services through DG reform. And some takeaways from that working group were that improving the quality of life of older people is always in the center of integrated care policies. So this is the #1 goal before all other goals. And active aging and health promoting policies are part of integrated care, because integrated care is always aiming at prevention and preventing also the appearance of care needs. So it's really an essential part of those policies. And users are often involved in those policies and evaluation, but less at strategic level, like the planning and commissioning of services for older people. And a best practice directly related to active aging and health policies, preventative policies, are the gerontology centers in Zagreb that were presented. And it's an initiative that is community-based, and those centers have been founded really close to the people in Zagreb, so that they don't have to take longer distances to go to such a center. And what they do is they advise people that are looking for activities that they can do. They advise people on services available to them, like home care services, volunteering services, and also they also provide medical support if needed. And those services are coordinated by social workers, and it shows the integration of health and social services. And what we also do is, we bring our members together, we have surveys, we do research, and this knowledge needs to be concentrated somehow and disseminated. So we have a lot of publications that are available on our website. We produce toolkits for public authorities how to apply the results and outcomes of the research. So we have a toolkit on investing in later life that was published in 2017, which is a result of different working groups and research. And there we have different chapters, and one chapter is about how to implement active aging policies at local level with concrete tips, and so that it's really useful for our members. We also will write a toolkit about service integration based on the working group meeting that we had this week, but also in the previous years, because it was a 4-year working group. And other services available or other studies available are on procurement and quality of long-term care, which you see directly on the right side. We had a study on the care workforce, which is a very important element in guaranteeing access to quality care, of course. Then we had a study on service integration for all user groups, not only older people, and a study on contracting for quality, looking at the relations between public authorities, providers, quality assurance, and users in the provision of long-term care. And we provide our members with a practice library where we write down all the best practices that we get, and those are accessible at our website. And in our newsletters, we disseminate best practices from our members, and of course inform about newest developments at EU level regarding long-term care and general social policies. We also are implied in a project on rural care, which is funded by the European Union. And this project takes place in the region Castilla y León and brings together public authorities and university to look how people in rural areas can receive better long-term care. And it's a 3-year project looking at, in general, best practices worldwide and how those best practices can be implemented at the local level in Castilla y León. And the last activity I will shortly present is our international conferences and awards. So we have the European Social Services Conference, which exists since 1992, since the beginning of the European Social Network. And this is open also to non-members. So if you want to have a look, you can look at our website, esn-eu.org, and the registrations are open. And this year it's an online conference. And then we also have the European Social Services Awards, where we steer innovation by presenting good projects and by awarding them for being innovative and showing new approaches to find solutions to social issues. And this started in 2019 and is always happening at the end of the year. And the applications for those for this award will open soon in the month of June. And this is about our general activities and how we steer cooperation and innovation.
Okay, thank you, Martin, for the presentation. We're probably going to save like the discussion and the questions for after the presentations, just so we can have like the pacing. But now what I would say is for Nicola to present the AAL Association and the programs and initiatives that they have. So then we can have the last presentation, also a presentation about by the European Commission, and then a bit further discussion.
Okay. Let me know if you see my presentation.
For now, we only see the desktop. Okay, now we can see it in presenter mode.
Right, then I will have to do this.
Okay.
Aha. Let's see how to do that.
Once again, this is the time, as Martin mentioned, to zip your coffee, zip your tea, whatever is your drink of choice, while we put everything going.
Well, so you should be able now, right?
Yeah, now we see it perfectly.
Okay, thank you, Claudio, and also thank you for inviting me and the AAL to this interesting webinar on the collaborative approaches, which is actually probably one of the main and most important elements of the active and assisted living program since its very inception. My name is Nicola Filizzola, and I am the Communication and Public Affairs Manager of AAL since quite some time now. So I think some of you already know me. And let me go further with this presentation, by which I think I want to drive you through a short journey around the program. I know that many of you already know all these things, but I think it's always important, to fix the framework in which we operate, because it gives also the importance and the limits to our discussion. The AAL operates within clearly the demographic change in Europe, so within the framework and the spectrum of an aging society. So a society in our continent where the average age is expecting to grow very significantly, because I think today is around 73, 74 for men, and is going to grow until 88 in 2070, where the population of the 65 people will also grow very significantly to almost 1/3 of the total population. But also there is a very important indicator, which is the ratio between the people at work and the people in pension, which is going to decrease. So there will be less people at work for the people in pension, and this will have very significant repercussions on the way we have conceived our society and what we call the societal contract in a way. I have to find a way. Yeah. However, the AAL was born not, on the issues or on the obstacle or on the drama that the aging population is actually creating in the eyes of the media and the press, because let's face it, aging is a very good news, no? I think the contrary would be actually rather bad, like a former president of AAL would say. And so we have grown, and we were born in the positive aging, say, approach of society. And so here, as you can see from the Sapir report, there are some aspects which I think are very important to fix on the positive aspects of aging. So the older adults, for instance, are more and more taking a productive role in society. And so, for instance, they want to become entrepreneurs. They have there is a strong element of wisdom and experience, which benefits very much our society and also the labor market, if we could be able to make the most of them. And there is also a very big element of support of the elderly people in our families, in a society that is very quickly evolving. And not least, there is a very strong element in the economy, so in what we call the silver economy. So all those say all the industries that navigate and rotating around the aging society, that goes from health and care to mobility to travel, but these industries are growing, and there will be a very continuously stronger and stronger demands of this type of services, but in our field, especially of ICT tools, and within that of robotics and artificial intelligence. What is saying? Yeah. The mission of AAL, it's very simple. So we were born to enhance the quality of life of adults through the development of innovative digital solution. We would like also to support the long-term sustainability of health and care systems by doing so. And there is also an element of the support and the fostering the emerging industrial base in this sector, which is, as I mentioned before, the silver economy, if we want to call it that way. We are a European association composed of 18 countries. It is a joint European secretariat based in Brussels, and since 2008, we have managed indirect and direct funding from the European Commission and from our member states. And this is a slide which encapsulates, this is a slide of figures now of AAL, because so far in these years we have launched a very, would say, significant number of projects, 265, for an average funding of 1.4 million, where 1 in 8 of these projects went to market. I think this is a very relevant figure also if you compare it with a private sector incubator. And then all across the time of these years, we also organized 11 editions of our annual event, which until last year was named the AAL Forum.
I think we lost your sound, Nicola. I don't know if there was a bug or anything.
Can you hear me?
Yeah.
Sorry. I was saying that we will call it, we will rebrand the event, which will be named the European Week of Active and Healthy Aging, where we every year in a different country, we manage to bring together an average number of 700 people. What are the tools we utilize to carry out our activities in these programs? On the one hand, we have the call for proposals. This is the core business of AAL. We have support actions, and we have the events, communication, and dissemination. When it comes to the call, to the management of call, this also might sound pretty familiar to everyone, but just to refresh the mind of those who are not familiar with AAL, every year around the period of March, we launch a call for proposals for consortiums that should be composed of minimum 3 countries and 3 types of organizations. In our case, they are the end users, organizations, a business entity, and the research and development entity. And the average amount of funding in this case goes from 1.5 to 2 million. We have a strong focus on end users, so they are at the very core of each project development phase from A to Z. And I would also like to recall what is the definition of end users in this particular sector. We see 3 levels. The first level are the older adults directly, those who are actually utilizing the active and assisted living products. Then we have the secondary end users, so those persons or organizations that are in contact with the primary end users, say families and friends. And then we have the tertiary end users, so private and public institutions that are not directly in contact with the AAL product and services, but acts as sort of filter between these two entities. And then the operating, I think this was also important to present so as to explain what are the type of market where we operate. So there is a private consumer market for AAL, then there is an institutionalized market where we traditionally see in the first one solutions such as well-being, lifestyle, independence, fun, and comfort being the focus of this area. Imagine, you know, any type of app or device that can support, for instance, training activities or fun activities or traveling activity. Whereas when it comes to institutionalized market, the solutions at stake are more related to health and care, social care, and housing. The other chapter that I would like to cover are the support actions, which for us cover a very highly importance because are those type of actions which allows us to support the project in their phase from research and development to the commercialization phase. The first of these activities is what we call the AAL to business, which is split since last year in two subcategories, which we have called the Lean Startup Academy, sort of a formative journey for new projects, and then the Market Launchpad, for more mature projects, where we help them to shape their business models, their pitching phase, and also the search for funding after the end of the program. This is another type of activity that we have developed in the last 8 years, every 3 years, I have to say. The Smart Aging Prize is a type of innovative measure, is a challenge prize for innovators, not necessarily in the area of AAL and not necessarily only for AAL funded projects, but it is conceived indeed to open up the scope and also the type of participation to our, say, incubation phase, and it is constituted on a cash prize and a sort of support throughout all the process of development by industry experts. This other chapter instead is something that I think I prepared in view of this particular webinar, because I think in the last couple of years we have become very active and extremely interested in one aspect of the collaborative approach, which are the ecosystems. This is a word that is becoming a new buzzword, I think, in our European bubble, but indeed it's something that we can see as a tangible trend, as a tangible activity that is bringing together lots of people and especially giving structure to something that perhaps we have looking for in the past years. And so the type of activity that we are carrying out here is first, currently we are doing a research on the existing ecosystems in Europe in the health and care sector and trying to understand their organization, their structure, and their objective. From the first findings that we managed to gather and to take stock, I think we tried to identify what typically is the type of objective of this ecosystem. And so, as I write here, is to learn about existing health and care ecosystems to start building a European action agenda. And then we tried also to identify a current definition that pretty much fits for the majority of what we have seen. And so we have noticed that in many of these definitions, the health and care ecosystems are constituted of a group of interconnected stakeholders as entities that are linked together through a mutual goal. I would add to this phrase that there is also a geographical element. So this first sentence has to be related to the fact that the healthcare ecosystem is always related to a typically regional or micro-regional geographical dimension. Well, this is the typical scheme of an ecosystem that we are seeing around Europe. As you can see, there are many types of stakeholders, from municipalities, regional authorities, training institutions, regulators, and all around these ecosystems. There are these organizations, there are actual type of ecosystems that are bubbling around but to create a new type of benefit for their authorities and organizations. Well, this is a few slides also to explain to you what we do in terms of communication, in terms of stakeholder engagement. As I touched upon briefly before, we have an annual event which every year is organized in a different country. Clearly, unfortunately, from last year, this has started to take place online also. This year it will be online, but normally I think there is this dimension of the physical connection and of the physical networking, which we have seen to be the most significant and most important part for our stakeholders and for our individuals. I think after talking very much on webinars, exchanging, emailing, and project development, it is very important once in a while to meet in person and to see what are the results of what we do. So that's why, for instance, in our forum, we always have an exhibition area where the results of our projects are showcased and are also tested by end users. And there are also, in some cases, also meet up between project developers and investors. As I said, since last year, we started to rebrand our event into the European Week of Active and Healthy Aging, which I would say in this case, fortunately, could go online because we found another way to let people meet. And this year we will have the next edition in October, between 18 and 22 October, to which you are all invited. There is a last set of also slides because, as an AAL program, we are going into a phase out as of July. So since last year, we started also to investigate what were the tangible and concrete impacts that our program has had in the last 12 years. And we find out something that was also quite refreshing for ourselves too. And so, wait a second, I'm not able to navigate this presentation today, my bad. Yeah. And so we identified, we tried to identify and we tried to do, also to break down the impacts of the program by isolating the first initial goals. As I said before, one of the goals was to improve the well-being of older adults through the use of adaptive technology. And through an independent impact assessment analysis, we found out that the main impact that the program had was on the increased sensation and feeling of safety at home, for instance, for the elderly people, the possibility to maintain interaction with other people when using this type of technology, and also the maintenance of physical and mental abilities. When it comes to the second goal, instead of the AL program, so to stimulate the development of an age tech sector in Europe, so to work within this silver economy sphere, I think what we find out was that we managed to support first solutions to get to the market in Europe in this AL domain. I think we managed to better understand the market segments. So, as I said, there are various segments: the health and care, the mobility, social care needs, and so forth and so on. And then we also see, and we can experience, an increasing investor interest in AL solutions. Clearly, also here, difficult to say which market among the ones that I mentioned is the driving force, but clearly there is a rising interest from the investment sector. And goal number 3, which is the contribution towards a more sustainable health and care systems, we could measure a reduced pressure on health and care infrastructure by some indicators. We also find out that by the usage of the AL technology put in place in the last 12 years, we could manage to early detect some risks in the care and homes sector, which is also something that can really, for instance, our caregiver organizations and individual and professionals across the continent. In the last year, we carry out a campaign on the impact of our solutions on COVID-19. Luckily and very happily, we also find out that many of the projects that then became a spin-off and company, which went to the market, had a very, very significant support in some specific area such as the the feeling safe at home or on your own environment, as a psychological support both for the primary and tertiary end users, and also when it came to the communication with families, which, if you remember, in the very peak of the pandemic was one of the big drama, right, for elderly people being isolated in care homes. These two are the type of solution that we developed, and that were used during the pandemic and still are in care homes, for instance. And these four are, I would say, what are the opportunities that we see ahead. And I finish with this in the next 10 years. No, in terms of spending, as I said, there is a Europeans over 65 have a spending capacity which is remarkably higher than the other age sector of the society, which has been identified in 3.7 trillion. There is a technology asset, a technology opportunity, because older people are adapting to their homes, adapting their homes to be smart, and there is a market also there that is very much increasing, and that can represent a market worth 15.5 billion. And there is also, in our view, a sort of revolution in the labor market, because elderly people more and more want to participate actively in society by working, not only by going to take the grandkids at school, but also by being active in the labor market. And finally, there is a global spend in the tourist, for instance, sector, where the 65 plus spend on average 53 euro a day, which constitute a very big amount in this space. Having said that, I think, because I was pretty long, perhaps, I'm sorry, Claudia, but I will finish my presentation here, and I will be happy to take any questions during the Q&A session.
No problem, no problem. So now we would have Bettina Glaser from More Years, Better Lives. So Bettina, as long as you're ready.
Yes, so just 1 second, as before.
There was always the Zoom transition time.
Yes. So I hope you see my presentation well.
Yeah.
Perfect. So hello and a good afternoon also from my side. I am Bettina Glaser. I'm the Austrian delegate of the JPI More Years, Better Lives, and I work in Austria in the Austrian Federal Ministry of Education, Science and Research. And I'm not just the Austrian delegate, I'm also a member of the steering committee, which I will explain you later. And yeah, I will present you now the joint programming initiative More Years, Better Lives, the potential and challenges of demographic change. So, as you all know, Europe faces societal challenges which single member states are not capable of resolving alone, like climate change, energy, aging population, or protection of cultural heritage. So therefore, the joint programming initiatives were funded to tackle the challenges. And JPI More Years, Better Lives started in 2012. So we have our 10th anniversary next year. And at the date, we have 16 member states in Europe and beyond. One of our biggest member states is Canada, but we have the most in the European countries. So on the next slide, you see the governance of the JPI More Years, Better Lives. As you see, we have a General Assembly. This is the governing and main decision-making body. We have delegates from 16 member states, and our chair is Peter Ellebeck from Sweden. The steering committee deals with daily and urgent issues on behalf of the General Assembly. And it consists of the chair and 3 representatives from the General Assembly. The chair is Peter Ellebeck, and I am here in the steering committee, and my colleague Katrin Nostad from Germany and Aziz Naji from Belgium. We have 2 advisory boards in our body. We have the scientific advisory board that gives advice to the GA on scientific issues, on research priorities and trends, and its members are scientific experts in relevant fields of study. Our societal advisory board provides advice to the General Assembly with clear orientation of societal dimension and challenges of demographic change. Its members are representatives of European-level societal agencies, as you know, the Age Platform, for example. And last but not least, we have our secretariat, which is based in the Netherlands. Sorry. So, the aims of JPI More Years, Better Lives. We increase efficiency and effectiveness of public research funding in Europe. We inform policymakers on issues on demographic change. We explorate and understand, to explorate and then understanding demographic change through a cross-disciplinary and holistic approach. The cross-disciplinary approach is very important for us, so it's very important. Then we have alignment of national, regional level and EU programs and activities, and of course the public engagement. On our strategic research agenda, we defined 4 research domains, which you can see here. It's quality of life, health and well-being, the economic and social production, governance and institutions, and sustainable welfare. And these 4 research domains split up in 11 research topics, which are, for example, aging in place, inclusion and equity, and technology for living, for example. We have the following instruments in our joint programming initiative. We have joint transnational calls. We try to make them annual, but we had a gap between some years. From now, we have 4 calls. We have a so-called virtual common pot. So every country that wants to participate in the call can put the money in a pot and fund their own researchers. For now, we had 18 research projects on the topics equality and well-being across generations, aging in place in a digitizing world, welfare, well-being and demographic change, and extended working life. Another instrument are the fast-track activities. These are short-term projects with duration from around 6 months. We had 4 fast-track activities so long on the topics age and technology. We have a data mapping project that is on our homepage. I'll show you the link later on. And we are updating it now because it was our first fast-track activity. We have a fast-track project on demographic change and migration, and on understanding employment participation of older workers. And amongst these 2 instruments, we have workshops and conferences and seminars. We have a strong existing collaborations. Here are some examples. We have joint workshops with other JPIs. We also contribute at the AAL forum, as my previous speaker already informed you about. We also collaborate at the European Week of Healthy Aging and with the WHO Decade of Healthy Aging. And we also move on with the collaboration. We have joint calls in the future. We have joint statements on policy issues. And we also want to participate, we are participating in the Horizon Europe partnership on transforming health and care systems. So, well, so sorry, I've lost my thing. So the advantages of the JPIs. Important for us is the programmed approach to enhance coordination and collaboration between national and international research programs related to the demographic change. JPIs are member state driven. We bring together national research funding organizations, ministries and research councils in Europe and beyond. And we contribute to achieving key global goals included under the Paris Agreement and the 2030 Agenda for Sustainable Development. So, well, it's in a nutshell. If you want to know more about the JPI More Years Better Lives, then please visit our website. It's jpi-demographic.eu, or visit or write an email at jpimybl@zonemv.nl. Thank you.
Thank you, Bettina, and thanks a lot for the presentation about More Years, Better Lives. Now, before we move on into the Q&A, I would just ask for Brigitte Morillon, Program and Policy Officer at the European Commission, just to have a few words on what is the future that the European Commission is seeing for active and healthy aging, particularly with joint collaboration in mind across Europe.
Yeah. Thank you, Claudio. As the previous speakers very well prepared the ground to say that aging and demographic change is a big European challenge, and that's why it's also very high on the European policy agenda. We even have a commissioner now that is responsible for democracy and demography. It's Commissioner Suica. And last year in June, there was a report published on the impact of demographic change, and that was then followed in January this year by the publication of the Green Paper on Aging. And that Green Paper launches the debate, the policy debate on aging. So we're really taking the topic of aging, of demographic change to the higher levels, to the policy levels. And in that Green Paper, aging is approached, and healthy and active aging is now taken from a life course approach. So there were in the past, maybe we were more looking and focusing on the elderly people. It's now taken, aging is taken as a process from the day we are born till the day we fortunately die. It's a process that you tackle throughout your whole life cycle, and there is a focus on this active aging. So and with the launch of the Green Paper, there was also a public consultation launched, and I hope you all replied and reacted on that, because it closed last week. And we're now about to process the results and to take them into account in order to formulate further policy actions to strengthen this domain. And you all know about the Green Deal, about the digital transition, which is a big challenge for Europe. And I won't say we have a silver deal yet, but let us try to make that the next big European project is the silver deal, and how to take care of this valuable aging population in Europe, because as Nicola pointed out, it's not a negative story. It's we should grasp opportunities and challenging of aging together. And in the past, the Commission has already supported several research and innovation programs like AAL, More Years, Better Lives, that were presented before. And these programs focused on developing solutions, research, innovation tools, developing technology to support the elderly to age in their place at home and to keep them healthy. But we have all these technologies now, and what we should do is bring them really to the people, bring them in their homes, in their communities, so we all, when we grow old, can benefit of it. And that's not only about our research, developing new technologies, new solutions. It's a complete cultural transformation that we need to support there. And also, like Bettina said, interdisciplinary approach is very important, but also the cross-policy approach, because it's not only about the social systems or the health system or education or research. We have to bring all these dimensions, all these policy dimensions together, and in order to tackle this societal challenge. And bringing all these policy dimensions together is also already a challenge on itself. And to add upon that, the cross-policy approach, we also need a cross-level approach, like I say, from the very bottom, from the local, the municipality dimension, to the regional, to the national, and then the European level. So we have to cross all these levels in order to make it happen. And there was already mentioned there that for the future actions, what we're actively working now is within Horizon Europe program, is the partnership on transforming health and care systems, where there is a clear focus on the challenges of the aging society, and also the digital technology support in that. And it's about bringing all member states together to learn from each other, to experiment, to test in tackling this challenge together. And there are the actions like the project organizing this webinar today, the support actions, where we support implementation of existing services, tools, and to upscale them and to bring them really to the people, so that every European citizen can benefit of it. And then recently we also started a kind of online community, or a platform where that's called Active and Healthy Living in the Digital World, where I would invite you all to subscribe and to bring all activities together within Commission, supported from Commission side, so that you can exchange information, that you can exchange good practices and learn from each other, and maybe not only good practices, but also exchange things that didn't work, so that we don't have to face the same barriers or failures, but that we learn from others what worked well, and more particularly what didn't work that well. So it's very important to work together in this challenge, and to secure our future, and let us age healthy in our own environment.
Thank you, Brigitte. Thank you a lot. Now we're going to move into the last part of this webinar, which is the Q&A / open-ended discussion around some of the topics. In that regard, I would invite all the speakers to come into the virtual stage, basically, but also Professor Eliseo Costa from the University of Porto to launch one question. We'll be always giving priority to people in the chat room if they want to have questions, pose questions, or if they want to pose a question, you can just lift your hand. We'll always be given priority to it, but I think for a palate cleanser, probably Professor Eliseo already has 1 or 2 questions in mind.
Thank you, Claudio. First of all, I want to thanks to all of you that present your networks, and also to Brigitte to give their input. And I must tell that that has been great and very, very, very interesting to know.
Professor Eliseo, we are having a bit of trouble hearing you.
What we are doing across Europe about active and LTA. Sorry?
We're having a bit of trouble hearing you. Maybe turn off the camera. Maybe that's a bit easier, because the signal seems to be very weak.
Yeah.
Okay.
So
Okay.
are you listening now? Better at least?
Yeah, we can listen to you now.
Sorry, but here I'm in faculty. I'm in my office in a university, and in my office I don't have a lot of internet. It's crazy, but it's true. So I think first I want to thank to all of you for the great presentation, and also to Brigitte for their comments. I think our challenge here is about how we can work together. Because in fact, there you present great networks that are working, I think, in a very good way and with very good results. But in fact, our challenge is how we can work together, the different networks across Europe on this field. And my first question to all of you and to discuss is, what do you think are the barriers for this, for we work together and to have some kind of initiatives, of joint initiatives? So I don't know if you listen to me well, but Claudia.
We can listen to you. We can listen to you. So the question was about barriers that we're having in terms of joint collaboration, particularly cross-border collaboration. So yeah. So if anyone wants to take the debate and answer.
Maybe Claudia I can say something from our experience at the AAL. Do you hear me?
Yeah, we can hear you fine.
I think the learnings we founded, across those very intense 12 years of activities are very, very elementary, if you want, but there are some obstacles that are clear and unavoidable. I think there is a lack of knowledge of existing partners, for instance, of existing services, of existing issues, and so there I see this type of European platform as a very needed systems and systems and moments where where the organization from the local and from the national level can actually get together and can get to know things. Also because we don't have to forget one other very important thing, which is the language barrier. So in the English language, we all speak the European English, but we are missing out on many people and organizations who are not very acquainted with English and cannot participate in this fora, for instance, one of today, because of the language barrier. So these type of platforms are very much needed for that. And then I think perhaps there is a third element, which I personally, but also as an organization, we see more and more, which is somehow a sort of lack of win-win approach to things. When you adopt a win-win approach to things in general, you have to come to the conclusion that you have to give in something in order to get to a wider benefit. I think this type of collaborative approach which also comes from an individual internal approach to life. It's something that we should instill also in the way that our organization works.
Okay, so does anyone want to add a bit more to this answer?
Maybe from the perspective of our network, or my personal experience in the network. So I just speak about my personal experience in the network, is that a potential barrier of collaboration can also be the lack of understanding or lack of engagement from leadership in looking a little bit beyond the horizon or out of the box and be in contact with organizations from other countries, and we try to make this attractive and attract people to participate in such exchange. And for example, one anecdote from a member visit that I had in Germany in a local employment agency, and I entered into that agency and I saw that there was a whole floor with people working on international projects. So, and it was a small employment agency, and so it was really interesting to see that the local manager had this vision of, we want to collaborate with others to test new approaches, new ways of working in employment, and manage to attract so many projects and have then so many people working on collaboration. So I think we need to convince always people to invest, to look beyond the horizon. And one way that we are doing is, for example, for the last working group that we had on integrated care and support, to invite some potential members to participate and to make this positive experience of exchange, and then see the added value. Because from the very start, it's sometimes difficult to convince people to participate in such events. But once they've been there, they are always very positive about it.
Can I still because I think what I want to ask is how we can collaborate each other between the networks, and if you see any gap in this collaboration, because we have here the presentation of 3 important networks. We the IN-4-AHA consortium represent IN-4-AHA community, and we need to start some, or it will be allowed that we could start some kind of collaborations, and is why I'm putting this question directly and asking directly how we can collaborate. If you see any chance that we could have some kind of work together.
Once again, does anyone want to take the bait for this?
May I say something?
Yeah, of course.
Yeah.
Well, I asked a question already to Nicola and Birgit. I think cooperation in a regional ecosystem is what we have learned, at least from myself, in the past 12, 20 years, so to say. Also, I was in the beginning of AAL, and we have been participating in, well, several AAL-funded projects. But what we had, for instance, is, let's say, a company from Portugal, an end user from Romania, a research institution from Germany or Finland or wherever at the beginning. How can they work together? Not. That has been proven. So I would suggest that if we go on with AAL or with EU-funded projects in the near future, that maybe, and that's why I liked the idea of Nicola when he said something about regional ecosystems. Please bring a total ecosystem, including all stakeholders, so elderly care organization, institute, companies particularly, all stakeholders from one region, and let them work together with 2 or 3 other regions, complete regions. That might be a solution. Because all the other have failed so far. It didn't. I was myself also participating in let's say, yeah, we did user analysis in Romania, and then there was a company bringing that insights into Germany. That didn't work.
Bridget.
Yeah. Thank you, Ed, for the question and the remark on the observations. It's something that we are already supporting, was within the European Innovation Platform on Active and Healthy Aging, and is also used through our different other projects now and programs, is what we call the twinnings. And twinning is kind of transpose, because you have a solution, especially in health and care sector, of course, if you have a solution in a region ecosystem embedded, you cannot just copy paste it from one region to another, because there are these organizational differences, and health and care systems are organized differently in the different member states, in the different regions, and they are tackled on national level, on regional level, although throughout Europe it's managed differently. So cut and paste, like I always call it, doesn't work. But it's interesting to bring regions where they have already implemented a solution, and another region that is looking into that solution and wants to adopt it, to bring them close together and to let them learn from each other experience, and to throughout visits and real working together in a concrete project, and then help the other region to design, to take into account the stakeholders, that maybe in the Netherlands it's a home care organization, and in Italy it will be a hospital that is responsible for delivering certain services. So there the twinnings, they show really that it takes time. And I think hurdles to collaborate or to bring people together, it's also learning to know each other and talking the same language. We all talk English, but it's also getting to understand the background of the others, and it takes some time to get to know, to get familiar with each other's semantics. And that's something you need to do, I think, in person. And unfortunately, we're not at the right moment now with the pandemic to do that. But I really believe in the twinnings as an instrument to support this transfer of innovations from one region to another and embed them in the regional ecosystem. When it comes to more the business side, to the entrepreneurial side, I don't completely agree with your observation, because I think programs like AAL are a very good instrument for companies that want to get out of their home market. If they develop something in one region or on one country, and they want to explore another market, then I think it's a very good instrument to get into touch with these healthcare stakeholders, with the social care, with the users in the other country, and so get out of there. Yeah.
I agree, but of course, we, as Nicola said, we had only one of 8 projects that really came to the market, and most of the companies are SMEs, small SMEs, startups, scale-ups. So I think most of the companies are happy that they can make it within their own country. Mm-hmm. But I agree, it's an instrument. You're right.
Yeah. Well, perhaps if I can add something. Sorry, Lizio, be very short. I can add something. You know, we are really building the blocks of the learnings on the function of ecosystems. No, I think as a matter of fact, with both of you, because I think that the future may be a 2-track program where you have a track dedicated to the real boost and kickoff of companies to the next level, which I also believe it works in this type of scheme. And then another type of track where you instead try to boost the institutionalized, say, ecosystems of the services, the company of the health and care and the social care to the next level. And in that case, the ecosystem approach indeed is much better than this one, which is more company oriented.
Just me tell one thing, because Brigitte tell one thing that for me is very, very important, because usually we report when we have success. And for me, we need to start to analyze when we fail. Because everybody knows this, but usually people do not share their success. And I think we need to analyze this in the near future, because I have some experience with the twinning projects. And I must tell you that I think in 4 twinnings, only one has been of success 5 years late. And I have 4 twinning projects, some products that are not available yet. And I think this is very important to analyze the reasons for this. I only wanted to push this question for here.
Yeah. Yeah, can I, because we have 2 people on the pipeline. One is Dr. Anupama Haq. He wants to ask some questions. So if you want to activate the microphone and pose some questions, that's fine. If not, I can pose the questions that you posed in the chat room.
Thank you. Hi. So my question is rather specific. I represent small startups. We are Vienna based, and we are providing digital health management services to the elderly. But in the current payer framework that exists in Austria, we cannot really scale up because it's too expensive, and the health insurance companies, they do not include these services as part of their framework. And there's also no provision from the government side or any funding agencies as well. So I think this is a common problem when we try to partner up with different countries and companies there. So my question is, can we, for this kind of startups who are offering digital health management services, which also tackles the questions, what resources do we have to manage this elderly population, which is increasing. So the demand side is really increasing, but we really don't have enough human resources for this. So I think the way forward is a lot more digital health management services and strategies. Can we then include these into a revised financial framework? And can EC help us to do this? Thank you.
Suppose I am EC. I don't represent the whole commission.
This is very targeted.
I can reply, yes. Yeah, first of all, health is a member state level competence. So the commission is only can only look into what you call the cross-border aspects of it. And indeed, I think the pandemic showed that telemonitoring, teleconsultation, all the tele whatever solutions are much more used now. And what was impossible for 10 years in some countries, overnight became possible to have a teleconsultation with your remote consultation with your caregiver, and even being reimbursed by the healthcare system. So it really shows that there is an acceleration and in adoption of these digital tools. The reimbursement is national competence, and there we can't intervene. And we see that in different countries, different systems are being set up to what we call integrate health solutions or digital tools to bring healthcare closer to the citizen, where you see like in Germany, in Belgium, in Spain, you see this kind of validation or processes that are being set up and that lead toward reimbursement of certain solutions. It would of course be good to kind of come to a harmonized approach. You will never have the European one way to go and to cover the whole European Union, because there are always cultural national differences where you have to comply to, let alone just in injecting your data into the national electronic health record. We will not be able to harmonize that on the European level, not in the next 10 years at least. But you can come to a kind of agreement, of mutual agreement and mutual recognition on certain parameters or criteria for digital health services. And in the context of setting up this European health data space, we started to revise the cross-border implementation acts of health, and there we will look into digital health services, what is needed from a regulatory point of view for the cross-border delivery of digital health services, to see what can be done on European level. But the European reimbursement, we don't have one European health system, so that's a difficult one.
Thank you, Birgit. I wasn't looking for a pan-European harmonized framework. That is really a dream, weird dream, I would say. But what I am looking for is, we have all these network full of people with beautiful brains. So could we somehow connect these brains together and then come up with maybe guidelines, best practices lessons learned, what you have talked about, a lot of you talked about before. So sort of that a company or a national organization doesn't have to start from zero every time. And when I need to show evidence, I can at least have something in my hand to say that, look, this works and it is really beneficial. So can we go forward with this? So that sort of support and help.
That's also taken into implementation support is also one of the challenges or objectives of this partnership on transforming health and care systems that I refer to. I will put the reference in the, and Austrian is also actively involved in the drafting team of member states that is driving this partnership. So I would say, you raised it now on European level and go also the other way in your national system to raise that problem. So it comes from both ways. So, yeah.
So,
Thank you so
if
much.
I may add something, we have in Austria the platform Netzwerk Altern. It's a networking platform for on aging research. So maybe this is a good Anlaufstelle, a good point for you to go to. If I heard correctly, then you're from Austria.
That would be fantastic, Bettina. Thank you so much.
Okay, I put the link in the
Okay.
chat.
Thank you. Thank you.
Okay. We also have one more question from Alenka Rozaj, and I don't know if there's going to be time for much more, but at least for Alenka we have time.
Hello, this may be, I'm coming from Slovenia, from reference site Slovenia, Ljubljana, Slovenian Innovation Hub. And most of my question or suggestion has already been discussed. Through my experience, people, when they know each other and they trust each other, can be successful, although they come from different cultural environments and the different regions. So to get things moving, maybe we would create some thematics, maybe determine some actions or some themes which are common or some barriers, and then people from different regions who are interested in solving the problem would come together, telling what works with them and also telling what did not work, as Elisio said. And this is very important that we learn from mistakes, but not from our own only. So we would not repeat these mistakes. We had very good experience last year when we had a webinar for empowering the elderly people. We got 7 reference sites from 6 countries. And it was very good event because everybody came from different, with different experience from different viewpoints. And finally, we were like one family at the end of the workshop. So I think this works. And of course, we are missing the physical contact, the physical meetings, but also online, a lot can be achieved. Thank you.
Thanks. So I don't know if Elisio, if you want to add something to it, shuffle up the discussion as well, because I mean, we still have a few more minutes, like maybe 2-3 minutes.
Because the regional ecosystem, we have not too much time, but I can introduce the regional ecosystems on this, the role of the regional ecosystems, we can call them reference sites, but for me, they are reference sites. I think we can talk about regional networks and how we can enroll these regional, to improve these regional networks and connect them with these European networks. How you see this, because Alenka posed here the reference sites and so on. I want to see your opinion about it. IL program and Martin, and how you see the enrollment in these European networks, how you see the enrollment of the regional networks on this. at European level. I don't know if I understand my question.
Yeah, I think it's so how can reference sites and other regional ecosystems actually work with these networks a bit better and work between themselves a bit better?
And how they are important to bring them on board.
I don't know if anyone wants to add or comment about this.
I think no. Brigitte, at least you.
I'm not the only one.
I'm sorry, but and it's important to talk about it.
They are very important, the regional networks, because or the regional ecosystems, because in a lot of countries, health and care is regionally managed and organized. So it's there that it happens, and that we have to integrate the technology or the new practices into the healthcare delivery. And that's also a challenge, is how do we integrate the new tools, the digital tools in the current health and care practices. And that can only happen close to the healthcare providers, close to the people that should benefit from the care and from the social services. And we have this network of reference sites, or the kind of accreditation of reference sites that we started in the European Innovation Platform on Active and Healthy Aging, where we have a network of regional ecosystems, where we exchange knowledge through thematic workshops, but also support the transfer of innovative practices through the twinnings. And I think that proved to work. It's about de-risking the innovation. If you want to copy an innovation from one region to another, twinning is about de-risking that, and the conclusion can be, okay, I thought this was the solution to my problem, but now that I had deep dive into it, I see it won't work in my region, so I stop, I look for something else. And that's also a good outcome of a twinning exercise, that you decide that that's just not the way to go, because your system is a bit different, or your stakeholders are
twinning has that kind of filter, right, Brigitte? So because it has like this kind of low risk success or not, it doesn't really matter approach, because
no.
You bring in some experience, and then you kind of see if it fits or not, and if it doesn't fit, that's fine.
Yeah.
But my question, Brigitte, is more about, because we know this kind of but probably when European Commission financial project or IL program has give some financial support, and we have some kind of partners coming from different parts of Europe. My question is, probably will be better to enroll the partners will be the regional ecosystems and not and not an organization, is what I want to ask. Because in fact, for instance, we have a network of reference sites. I like, but I like to prefer to talk about regional networks or regional ecosystems. Okay, so probably if we have a call and the partners are not an organization, but these regional ecosystems, probably we can bring a more successful solutions, is what I want to put in the table.
Nicola?
Yeah, maybe what we're saying, I think this very much relates to also what Advan Berlo said. I think, yes, this is something that, yes, we are finding, we are learning and finding out that it can be implemented, but the other thing I would also comment is that it doesn't really fit all situations and reality in Europe, because what we are also seeing is that there are, an ecosystem is a very nice word today, but an ecosystem is a complete entity when it really works. And so where the private, the public, the research and development, the academia, the industry are truly working together. And this is not the case for all Europe. So I think also the Commission Commission understood that very long ago. And so So as far as I understand, for instance, the Digital Europe program is also very much geared towards this direction, also to give a very more independency and more independency of action to the ecosystem, so as to develop activities internally within their strategy and within their needs. Maybe the other last element that I would say that ecosystem would also be very beneficial for understanding the needs. Because for instance, in our case, one of the most important things is really to understand and know the evolving needs and wishes, not only we need, but also wishes of the people. So in this case, older adults, but they are still people and citizens, active and living and wanting to be healthy, people who have different needs, and the regional authorities and these ecosystems could help very much in that, because these are very, very much also things that evolve over time and not fixed.
Yeah, and the question is, of course, how big can an ecosystem be? What is it 100,000 people? Is it less, or is it 1 million people? I don't know. First, at the beginning, I thought it should be in cycling distance, walking distance, and we should meet each other. But that's of course not working. So I guess something like 500,000 people or something. That's at least a region. Yeah. Okay.
There needs to be some more definition as well in that regard. Okay.
Maybe I can just come back to the rural care project.
Yep.
So, as we are working a lot with regional authorities, and I was a bit stuck on the word ecosystem, regional ecosystem, but in the regional care project in Castilla y León, we bring together at least the research sector, so the local university and the public authorities and providers to work together on this project. And the university analyzes different best practices from all over the world, so over 30, and then looks which of those 30 best practices on delivery of care to older people in rural areas could be implemented in our region. So what is fit for purpose in our region? And then out of these few, they will take some of the approaches and try to implement them together with the partners on the ground. So the project is still in the implementation phase. So we have identified some best practices that could work on the ground, and now we'll be trying to roll them out. So if maybe this is somehow what you meant with local collaboration, and then ESN can disseminate, of course, the best practice to other regions on how they can adapt the best practice in their context.
Thank you.
Okay, so thanks. I'm just basically, now we have like 1 or 2 minutes until 4:30. And we actually wanted the webinar to be around 1 hour, and like 10, 15 minutes maybe. But the idea is now that we're kind of pushing for the edge of the calendar appointment, and we always like to give people the freedom for leaving just and having time to then go to other meetings. You know, some of you will probably have meetings at 4:30. Just from my side, major big thank you to everyone involved, to the speakers, and to everyone who actually joined the discussion here today. It was a very lively discussion. We actually been talking around 30-35 minutes, and it's been very enriching, I think, for everyone. From my side, the only thing that I need to say is that we're going to send a follow-up package to all of the people who have signed up. They will have the meeting recording, they will have the PowerPoints, and they will have some notes from the discussion, so that people who've signed up but were not able to stay for the full session, or signed up but were not able to attend, they can actually join in on the discussion and give us some contributions to it. From my side, once again, thanks a lot for being here. And as a member of, as a part of the IN-4-AHA consortium, this is also very important for us to get a grip on what these stakeholders and these networks are saying, what they are needing, because our point as a transition period and as managers of the previous IN-4-AHA community, which is now following up, and we're trying to create some action, some dynamics around it. For us, that's very important to know, for us then to actually adapt and apply our initiatives and activities in the best way possible. So thanks a lot once again. And from my side, anything you need from our end, please do feel free to reach out through our email and through, of course, all of the social media or other forms of media that you can reach us in. So thanks a lot, and we'll see you next month, because we always have a webinar or workshop each month. So we'll always be here to further the discussion further. Okay, thanks a lot.
Thank you.
Thank you. Bye.
Bye.
Bye. Thank you.
Thank you. Be safe.
Same. Bye-bye.